Welcome back. I'm glad you're here because today we're diving into a conversation that could truly make a difference in someone's life, maybe even your own. We're going to talk about something that doesn't always get the attention it deserves, but is absolutely vital: prostate cancer. It's a subject that can feel uncomfortable or even scary, but facing it head-on is the first step to protecting your health and the health of those you care about. Did you know that prostate cancer is actually one of the most common cancers affecting men worldwide? Yet despite how widespread it is, the early warning signs are often so subtle that they're easy to overlook or dismiss as something minor. That's why today, we're breaking down 12 early warning signs you should never ignore. These are the signals your body might be sending you long before things get serious, clues that, if caught early, can make all the difference in treatment and recovery. Ignoring these signs can have real, sometimes life-altering consequences, but being aware of them and acting quickly could literally save a life, maybe yours or that of someone you love. And remember, this information isn't just for men. It's for anyone who cares about men's health: partners, friends, family members, and colleagues. We all have a role to play in looking out for each other. By the end of this video, you'll know exactly what to watch for, whether it's in yourself or in someone close to you. So let's get started and take this important step together toward better health and awareness. First up, let's talk about frequent urination, especially those nighttime trips to the bathroom that seem to come out of nowhere. It's one thing to wake up once in a while, but if you're finding yourself getting up several times every night, it's worth paying attention. This isn't just an inconvenience. It can disrupt your sleep, leave you feeling tired during the day, and even affect your mood and energy levels. Many men brush it off as just a part of getting older, but it's important to recognize when something has changed. If you're suddenly waking up multiple times or planning your day around bathroom breaks, it's a sign your body is trying to tell you something. Maybe you're mapping out your errands based on where the nearest restroom is, or you're feeling anxious about long meetings or car rides. These adjustments might seem small, but they can add up and impact your quality of life. Here's why this happens. The prostate gland, which sits just below the bladder and wraps around the urethra, can start to enlarge as men age. When it does, it puts pressure on the bladder and the tube that carries urine out of your body. This pressure can make you feel like you need to go, even if your bladder isn't actually full. Sometimes you might rush to the bathroom only to find you can barely go at all. This isn't about drinking too much coffee or water one day. It's about a pattern that develops over weeks or even months. If you notice that these changes are sticking around, it's time to take them seriously. Keeping track of your symptoms, like how often you go, how much you go, and whether you feel relief afterward, can help you and your doctor figure out what's going on. While benign prostatic hyperplasia, or BPH, is a common cause of these symptoms, it's not the only one. Prostate cancer can also cause similar issues, especially in its early stages. That's why it's so important not to ignore these signs or assume they're harmless. The only way to know for sure what's causing your symptoms is to see a doctor. They can perform simple tests, ask about your medical history, and help you get to the bottom of what's going on. Early detection can make a huge difference in your treatment options and your long-term health. Don't just chalk it up to aging or hope it will go away on its own. Ignoring these changes can lead to bigger problems down the road, including more serious health issues and a lower quality of life. If your bathroom habits have changed, even if it feels embarrassing or inconvenient, make an appointment to get checked out. Taking action now can help you avoid complications later and give you peace of mind. Remember, early action makes a real difference. Listen to your body, trust your instincts, and don't hesitate to reach out for help. Your health is worth it. Next, let's talk about a symptom that often goes unnoticed until it becomes impossible to ignore: difficulty starting urination, also known as urinary hesitancy. This is a common issue, especially as men get older, but it can be confusing and even a little alarming the first time it happens. Imagine you're standing there, ready to go, but nothing happens for several seconds. You might find yourself waiting, feeling awkward, or even needing to strain just to get things started. It's a frustrating experience that can make you feel self-conscious, especially in public restrooms or when you're in a hurry. This hesitation isn't just in your head. It happens because the prostate, which sits just below the bladder, can become enlarged as you age. When this gland grows, it can squeeze the urethra, the tube that carries urine out of your body. Much like stepping on a garden hose restricts the flow of water. As a result, your bladder has to work much harder to push urine past the blockage. Over time, this extra effort can lead to other problems like a weak stream, dribbling, or even a feeling that you haven't fully emptied your bladder. While it might seem like just an inconvenience, this hesitation is actually your body's way of telling you that something has physically changed. It's a warning sign that shouldn't be ignored or brushed off as just a part of getting older. Don't try to push through or hope it will go away on its own. Ignoring these symptoms can lead to more serious complications down the road, including infections or even damage to your bladder and kidneys. Both benign prostatic hyperplasia or BPH and prostate cancer can cause urinary hesitancy. That's why it's impossible to self-diagnose based on symptoms alone. Only a healthcare professional can determine the real cause and recommend the right treatment. If you notice this symptom for the first time, or if it's getting worse, don't hesitate to reach out to your doctor. They can perform simple tests to figure out what's going on and help you find relief. Remember, embarrassment is never worth risking your health. Early evaluation can make all the difference, so don't wait. Take action and protect your well-being. Third, a weak or interrupted urine stream. If your flow is suddenly a dribble or stops and starts, your prostate may be pressing on the urethra. You might also notice dribbling after you think you're done. This can be inconvenient, but it's also a clinical clue. BPH and cancer can both cause this, so focus on the change from your normal. Don't just adapt, get it checked. Your urinary system is under stress. A doctor can help figure out why. Don't ignore a weak stream. It's a sign to act. Fourth, pain or burning when you urinate. Never ignore this. While it's often a sign of infection, it can also mean inflammation or even prostate cancer. If it's persistent or comes with other symptoms, it's more concerning. Don't just tough it out. A simple test can rule out infection. If that's clear, your doctor will look deeper. Pain is your body's alarm. Listen to it. Get checked right away. Blood in urine or semen is always a red flag. It can look pink, red, or brown, and while there are benign causes, you can't afford to guess. Tumors can invade blood vessels, causing bleeding. Sometimes blood is only found on a test, not visible to the eye. Don't wait or hope it goes away. See a doctor immediately. Early detection is critical. Even if it turns out to be minor, you'll have peace of mind. If it's cancer, you've caught it early. Act fast. New or worsening erectile dysfunction can be linked to prostate health. The nerves and blood vessels for erections run right by the prostate. A tumor can press on them, disrupting signals and blood flow. ED has many causes, but if it's new and comes with urinary symptoms, get checked. Don't blame it on stress or age without a medical opinion. Your sexual health is part of your overall health. Talk to your doctor. It could reveal something serious early. Don't let embarrassment stop you. Early action matters. Pain during or after ejaculation isn't normal. The prostate contracts forcefully during orgasm. If it's inflamed or has a tumor, this can hurt. The pain might be deep in the pelvis or lower abdomen. Other conditions can cause this, but combined with other symptoms, it's a warning sign. Don't dismiss it or hope it goes away. Chronic pain during sex is a red flag. See a doctor for answers. Protect your quality of life. Persistent pelvic discomfort or a dull ache can signal a growing prostate tumor. As the gland enlarges, it presses on nearby structures, causing pressure or pain. It might feel like fullness or a constant background ache. This can be mistaken for muscle strain or digestive issues. If pelvic pain is new and persistent, especially with urinary changes, don't ignore it. It could mean the cancer is progressing. Find out what's causing it. Don't just mask the pain. Get checked. Deep, persistent pain in your lower back, hips, or thighs can mean cancer has spread to the bones. This pain is different. It's constant, often worse at night, and doesn't improve with rest. Bone metastases weaken bones and can press on nerves. If you have this pain plus urinary symptoms, see a doctor immediately. Early detection of spread allows for better management. Don't dismiss it as normal aches. This is a serious warning sign. Act quickly. Your quality of life depends on it. Losing weight without trying, especially 5% or more in a few months, is a classic cancer sign. Cancer cells steal energy and nutrients, causing muscle loss and appetite changes. The immune response also speeds up metabolism and suppresses hunger. This isn't a win, it's a red flag. Track your weight and talk to your doctor if you notice unexplained loss. It's a sign something's wrong systemically. Don't ignore it. Early investigation is crucial. Persistent, overwhelming fatigue that doesn't improve with rest is another warning. Cancer drains your energy and can cause anemia if it spreads to the bones. Fatigue is easy to blame on life, but if it's severe and ongoing, don't ignore it. Especially if you have other symptoms, see your doctor. Blood tests can check for anemia and other causes. Don't just push through. Your body is telling you something. Listen and act. Swelling in the legs or feet, called lymphedema, can mean cancer has spread to pelvic lymph nodes. The lymph system drains fluid. If blocked by cancer, fluid backs up in your legs. You might notice tight shoes or deep sock marks. Many things cause swelling, but new persistent swelling with other symptoms needs urgent evaluation. Imaging can reveal blockages. Don't ignore swollen legs. It's a sign of advanced disease. Get checked right away. Those are 12 early signs of prostate cancer you can't afford to ignore. Awareness and early actions save lives. If you notice any of these symptoms, see a doctor. Don't wait. Encourage the men in your life to do the same. Share this video. You could save someone's life. Thanks for watching. Subscribe for more health tips. Stay healthy and take care of yourself and those you love.